Hello, everyone. It's another day with your fertility specialist. On behalf of Alps Hospitals, I welcome you, our dear viewers, to another interesting episode of A Day with your fertility specialist. I'm your host for this session, Ruth Ogogo. I hope you have a lovely time with us today. Thank you, viewers, for always staying glued to your screen, for always liking, for always sharing. Right now, as we get started, please still share this link with someone, call up someone. If you need to send data, like I would always say, please do that right away because we have a very, very important topic to talk about. Something that concerns the woman's health, young ladies, middle age, even the elderly, just whichever age group you fall into right now. This is very important for you. If you have a sister, call her up. Your girlfriend, call her up. Your mother, your wife, just whoever it is you need to call up right now. Please do so they are able to connect to this. And to talk about what we have to talk about today, we have a very special guest with us, like very special guest. In person of Dr. Divine Ernest. Dr. Divine, it's good to have you with us.
Thank you.
Viewers, I'm very sure that for our online viewers, Dr. Divine's face is new to you. I mean, for those that are physically present, yes, you know Dr. Divine as one of our doctors here at Alps Hospitals, but for the sake of our online viewers, a bit about Dr. Divine. She's a very dedicated medical doctor with extensive expertise in patients' care, disease prevention, and health control. Her, her zeal to see that patients are well taken care of is top notch. You have a medical doctor per excellence with us today. So it means that we are set to get the best of information and best of knowledge today. It's good to have you with us, Dr. Divine. Once
Hey,
again, you're welcome.
thank you. I'm blushing.
Oh yeah, I must say I love your outfit.
Thank you.
Okay, so viewers, as we get started, please drop your thoughts, your questions, your comments in the comment section, and let's respond to them appropriately. We're talking about something very important today. And what is it that we're talking about? For those of us that have not seen our flyer, we're talking about vaginal discharge. When is vaginal discharge normal and when is it abnormal? You know, a lot of times, this is something that concerns women a lot.
Yeah.
Sometimes, any small complaint, I'm sure, this is your field. You have a lot of them say, doctor, I'm having discharge. I don't know, I feel like I have infection. Some of them will tell you, I feel like I have infection.
Infection. Yes.
Yeah. So, well, to begin with, what's even vaginal discharge to begin with? Let's even know, is the menses that we see vaginal discharge, or let's know what vaginal discharge is to begin with.
Okay. Thank you very much. Well, vaginal discharge is a normal secretion, or is a fluid that comes out from the woman's body. It is
Okay.
actually produced within the human body.
Oh, I
So
see.
the endometrium, the cervix, and the vaginal glands itself.
Oh,
So this discharge actually helps to keep the vagina moist.
oh, I
It's
see.
an open place, so
Yeah.
it can be prone to infection. So this discharge now helps to keep it moist. And then within the discharge, it contains some microflora like
Oh,
lactobacilli that
okay.
produce lactic acid, that also produce a good pH environment to also protect against bacterial infection and
Wow.
all that.
Thank you so much, Dr. Divine. So it's good to know that we what Dr. Divine has told us about vaginal discharge. It means that for a woman, if you're having vaginal discharge, is normal.
It's normal.
Yes. So it's not strange. But we're going to talk a lot more about when it's normal and when it's not normal. Sometimes, like I mentioned, a lot of women will feel like vaginal discharge is a sign of infection,
Yeah, yeah.
or sometimes something, yeah, just a sudden change, and you get that feeling. I feel like I have an infection, and then the next thing they are just taking all sorts of
Yeah.
medications to flush out whatever is not even there in the first place. So when do we say a vaginal discharge is normal? Because at different points of a woman's cycle, maybe when she's in her when well generally in her cycle, when do you say a vaginal discharge is normal? When would you say vaginal discharge is normal?
Okay,
Yeah.
so before I answer your question,
Yeah.
let's talk about the normal vaginal discharge
Yeah.
based on the color.
Yeah.
Sometimes we ladies we see it comes out very clear. Sometimes it's whitish or milky.
Hmm.
It's actually normal. Then based on the viscosity or less the quantity,
Yeah.
sometimes it's thin and watery. Sometimes you see it quite creamy.
Mm.
Then sometimes you see it like it's like egg white, very slimy,
Slimy.
especially during ovulation. So
Okay.
that is also normal. Then based on the quantity, it's expected that at least 1 to 5 meals daily.
No,
So
wow.
it should not be more than that. Then take note that at every time of a woman's cycle, the discharge changes.
Yeah.
So just before ovulation, it could appear creamy. Yes,
Mm.
it's normal in preparation for ovulation. Then
Oh.
during ovulation, it becomes thin and watery or sticky
Oh,
or
I see.
slimy.
Okay. Mm.
During this time, it's expected that if a woman meets
With
with
her
a man
partner.
or her partner,
Yeah.
the slimy nature helps the sperm to travel through
Oh, I
the
see.
cervix and
Okay.
go for fertilization. So that's what helps.
Mm.
Then also after ovulation itself, sometimes it gets creamier or thicker. It's still okay. Just take note within your body because it
Yeah.
differs from woman to woman.
Mm-hmm.
So at the
True.
point where
True.
you understand your body, you will know that this
Yes.
is getting out of hand. You
Yes.
start getting worried.
Worried. That's
Yes.
true.
So during pregnancy too, the secretion is increased
Hmm.
because of high estrogen level. There's
Oh.
increased blood supply to the vaginal epithelium, the wall itself, and then the
Yeah.
cervix becomes more secretory to
Hmm.
protect during the pregnancy stage, prevent all those miscarriages and all that. So it's expected.
Yeah.
Then during sexual arousal,
Hmm.
the vaginal secretion is actually increased. So during
Oh.
those stages, you shouldn't be worried.
I see.
However, when you start noticing some changes like change in color as against the normal color, maybe green, gray color, dark yellow,
Hmm.
like the yellow is
Yeah. Yeah.
getting, because
Mm-hmm.
there are sometimes that it's normal to see your the as in within your underwear, you see that there's a yellow discharge. It's upon exposure to air that it changes to just slight yellow. But
Mm-hmm.
when the yellow is quite dark, you should get worried.
Okay, so before we get to the point of getting worried, we're still let's still talk a bit. For a woman that is breastfeeding, I know that sometimes you can see her, after the whole period where they no longer see the lochia, I mean the bloody discharge after
Yes.
delivery. Sometimes some of them will say that there's no discharge, it means they are not ovulating. Some
Yeah.
women will even say they did not see their period all through breastfeeding, or some women in menopause, some of them complain. So is there a difference with people that are breastfeeding or people in menopause, their discharge about that time?
Okay, yes. During breastfeeding, actually, there is some imbalance within the hormones.
Oh, I
It's expected that
see.
the prolactin, because of the breastfeeding, is elevated, and
Oh,
then the
okay.
estrogen level is reduced. So
Mm.
the vaginal secretion will be reduced.
Oh, I
So
see.
in this state, during the breastfeeding, you notice that the woman has less vaginal discharge,
Discharge.
and she
Okay.
experiences dryness, especially when she meets with her partner.
Mm.
It's normal, so she shouldn't worry. However, when menstruation returns back,
Returns.
she
Okay.
will experience the same because the estrogen will be back and all that.
So a discharge will not be
Yes.
normal.
So during menopause, we all know that the hormones are being the cessation of those hormones.
Yeah.
So estrogen is literally reduced. So the secretions will be reduced
Yeah.
at this stage, especially during pregnancy and during breastfeeding and during menopause. They're actually prone to infection because of those reduced estrogen and then the vaginal secretion itself.
Thank you so much, Dr. Divine. So, viewers, we in fact, I'm tempted to call Dr. Divine Professor Divine. Oh yes,
Oh,
the
please.
way like she has studied the whole vagina, she can practically
Please.
she can practically tell us a lot about vagina. You can see from this session today that there's a lot to learn from vaginal health, vaginal discharge. As we go on, it means there's just lots more coming from Dr. Divine. So please call up someone, drop your questions. Dr. Divine is here to answer your questions, and she'll definitely respond to whatever it is that might just be bothering you with respect to your vaginal health. Well, now we've established what was normal, so people know when there's a deviation from normal. Let's talk a bit about when it's abnormal, possible things that they could see, or possible things that they could experience, that they should immediately seek attention and not just be doing self-education wherever they are.
Okay. Before I answer this question, I remember one Saturday,
Yeah.
I was the one on call, and then a young lady walked in. I was like, ah, thank God, it's a female doctor.
Oh.
Apparently, she has been meeting the male
Yeah,
doctors, and
yeah.
then
She
she
feels
has.
like they don't understand what she's saying.
So when she came in, we exchanged pleasantries and all
Yes,
that.
yeah.
But then I asked her, okay, so what brought her here? What's the complaint? And then she now told me that, doctor, I have infection. And I said, okay. So how do
Okay.
you know you have infection?
Mm-hmm.
She said she knows she has infection. So I asked her, okay, what happened? Is there any changes? Tell me and all that. She said no. So I had to teach her. So now let's go to the abnormal vaginal discharge. When you start seeing something like the color, the change in color from green, yellow, or gray color,
Mm,
or cottage cheese color,
mm.
or you start having some itching, irritations, pains, the vaginal swelling, you should start getting worried that okay,
There's a
there's something
change.
going on within my reproductive system.
Mm-hmm.
So you should start thinking of vaginal infections. But apparently, the girl didn't even understand her menstrual cycle, didn't understand what's going on within her
Yeah.
cycle
Mm-hmm.
itself. She was a young girl, just barely 20 years, so she's still yet to understand. So I had to like teach her,
What to
explain to
expect
her,
every
and
face.
at every phase, this is the kind of discharge. And when I got to understand, when I got to explain to her, she was very happy and she left satisfied. So when you start seeing something like gray color,
Yeah.
um dark yellow, green color,
Yeah.
you see like cheesy, and based on the quantity is quite much, very very thick and much. Then smelling, oh, very important, foul smelling, fishy smelling,
Mm.
especially in BV, bacterial vaginosis.
Yeah.
Yes. Then some might not be smelly, some might not even have any symptoms, but within yourself, or when you start having lower abdominal pains,
Pain. Okay.
so you start
Knowing that these are
no,
some of the
yes,
signs to look
these
out
are the
for. So the fact that you are even someone might be watching right there, and you might have a similar symptom to whatever maybe your friend had that symptom, and then you now assume that it's the same thing that is happening to your friend that is happening to
yeah.
you. You just want to be quick to take the medication your friend took. So it's good that as we move forward, that you know that yes, as much as you might experience some of these symptoms, you still need to seek attention. These are some of the things that you see, that you don't do self-medication at home. You actually have to come to the hospital to seek proper attention so that you would be given proper care. I was going to ask, because sometimes a lot of women have actually been victim of poorly treated infection. So what are some of the practices that women actually engage in, that apart from poor hygiene? Of course, poor hygiene is general, but what are some of the things that women engage in that is actually very detrimental, that can actually predispose them to infections? Yeah, what are some of these
Okay, very
things?
important activity. What do you what
What are some of the things that women engage in that actually makes them prone to infection, that
Okay,
predisposes them to infection,
okay,
that are very wrong practices that they shouldn't?
okay. One of the
But
practices that I've noticed is douching.
mm,
So
genital adultery.
women
Yeah.
just use their finger to they go deep inside the
Hmm.
vagina,
As if
either with water or
they are
with
doing.
soap.
Hmm.
So it and the disadvantage of this is that it reduces the vaginal pH, and
Oh.
then the pH within the vagina actually helps to create a protective mechanism
Hmm.
against some bacteria and
Oh, I
fungi.
see.
And so some
In their
endogenous, even
mind.
some endogenous organisms, it prevents the proliferation of those, because normally the vagina also has some microflora,
Hmm.
and so they are within normal level.
Yeah.
So when you continue doing those practice, the pH is reduced, then that microflora that is supposed to be there within the vagina
Yeah.
grows and then become pathologic, causing problem.
Hmm. Wow. Wow.
Yes,
Hmm.
yes. Then using of vaginal perfumes.
Hmm.
I saw one online.
Oh
They
my
use
goodness.
vaginal spray.
Wow. Can
Hello,
you give
vagina
me?
has its own smell itself. Leave your vagina alone. It doesn't need to smell that sweet. It
Yeah.
has a special smell. Leave it that way. Then use of scented soaps to wash your vagina. Please, just normal water. It's okay. Then okay, I love giving example. I remember a lady that I don't want to call her name, she might know.
Oh yeah.
She said she does monthly vaginal cleansing.
My goodness.
Guess what is it?
Oh, good.
She sits
Wow.
on a boiled water, semi-boiled water,
Wow.
with
Tell me
salt
something.
inside, and then she's cooking it.
Wow. Wow. There's nothing.
Who does that?
Well, honestly, I can imagine.
Then sometimes she adds the toll to it to cook it very well.
My goodness. This is wow. So people still do all these
Yes,
practices.
they
Wow, you
do.
can
They do.
imagine.
Then
Wow.
they also go to and
That's
she does
extreme.
monthly vaginal treatment without any
Wow.
symptom. It's
Wow.
part of
She just takes medication.
it's a ritual.
Wow.
Yes, monthly.
Yes, it's really a ritual. That's the word. It's a
It's a
ritual. Wow.
ritual.
Hey. Well, I can imagine this is just extreme.
Yeah.
Now that as much as we're laughing over this, dear viewers, it's actually not a funny situation because a lot of people actually hand themselves in the notion of being hygienic to them or being
Yeah.
extremely they say I'm very sensitive and then
Exactly. That's
that's
the
the
word.
word. And then we do all these things not knowing that we're actually well, it's more like saying we are opening the door, just come. They are
Coming.
welcoming them,
Yes.
welcoming all forms of forms of infectious agents to you. And in
Yeah.
your mind, you feel like you're preventing them. So it's good that we're actually having this information today because a lot of women are actually doing this. A lot of
Very another
ladies.
important thing,
Hmm.
good hygiene,
Hmm.
especially toilet. I'm very sure that a lot of ladies don't know how to even clean themselves up after using the toilet.
Hmm.
Yeah, and then some mothers too don't teach their children. Like most times when I see young girls with UTI, and like small child with
Yeah,
UTI,
yeah.
I first ask the mother, "Did you teach your daughter how to clean herself up?" And then ask the girl, "Okay, how do you clean yourself up?" You now realize that she doesn't know how to do it. So, for I know we want to pretend that we know how to do it, but for the sake of those
Yes,
that
it's
don't
good
know how
for
to
them.
do it,
Yes.
you clean from front backward, not from back front.
Hmm.
From front backwards. Then also, please, I know pads are very expensive, but please try and change your pad at least 3 times a day. At least. Then if
Yeah.
you have heavy flow, please. We can buy wigs, we can buy let's spend on
Exactly.
that
Yes.
pad.
It's very
It's
true. You
very
can buy wigs. I
important.
mean,
So, but even if it means using two pad in a month, no problem. But if you have heavy period, please change your pad as frequent as you
as you
can.
can.
Don't wait until it's 3 times. No, you can also change it 6 times based on your flow. You should do that. Then I talked about use of scent.
Yes.
And okay, there's something they insert
Hmm.
into their vagina
Wow.
that also helps in cleansing.
Hmm.
I'm not going to talk about that,
Yeah.
but I beg you, please avoid those things.
They're not. They're
Avoid
not.
those
They're
things.
not the best. All these. We are speaking this language right now of vaginal health because a lot of ladies actually now begin to struggle with fertility due to
Yeah.
poor management of some infections. So now maybe we should talk a bit about some of the impact of this infection on fertility because it's a day with a fertility specialist and it starts from these little things that people don't see as it starts from this little thing that people don't see as important. They don't
Mm.
see they don't attach relevance to them. So what are some of the impacts of this vaginal infection on fertility generally for a woman here?
Okay. So the number one impact is that it can predispose you to pelvic inflammatory disease.
Hmm.
And this pelvic inflammatory disease is an ascending infection
Hmm.
because
Wow.
the first time you have the vaginal infection, maybe you treated it or you poorly treated it, and then it's still there.
Yeah.
Maybe it's silent, the
Mm-hmm.
symptoms are not there,
Mm-hmm.
so you think it has gone. Or maybe you finish treating it and then most times PID is usually sexually transmitted.
Yeah.
You finish treating, you go back to the same partner and then contact it again. So it gradually ascends, then causes tuber blockage.
Wow.
Yes.
That's that bad.
Yes,
Wow.
yes. Then and there are some symptoms of PID some ignore. There's pelvic pain.
Hmm.
Yes, pelvic pain, and there's abnormal vaginal discharge. Truly,
Discharge.
it's still
Yeah.
there.
Yeah.
Some come down with fever.
Hmm.
Yes, some come down with fever. Then you see these three most important signs minus
Yes.
the clinical and investigations and
Some
all
might even
that.
have pain with sex.
Exactly, this
Hmm.
paranoia. Yes, they do. So
If you are experiencing all this, so it means that you shouldn't just stay and do your self medication at
medications.
home.
Yes.
So I was also going to ask that what are possible because in this part of the world, a lot of people do self medication because all these medications are available everywhere. So they just tell you once they see any sign, they just go to pharmacy. I want to buy medication for infection. They just give them all those medication. Should I even call it pharmacy now or chemist? That's what they
Mm.
call them. But yes, ideally, yeah, pharmacy. But is there a risk that these people pose on themselves by doing over the counter medication or self medication? What are possible, I mean, what's the danger of them doing self medication? What can it actually do to them when they do self medication?
Okay, so if you go to almost all the young girls'
Hmm.
rooms, you
Hi.
might see doxycycline,
Hmm.
metronidazole,
And the likes.
and the likes. So self medication actually is very bad because sometimes it could mask the symptoms. Yes, it could mask it, temporarily mask the symptom,
Yeah.
but it doesn't really treat it.
What is
So
this?
it's best you come to the hospital for proper investigation. Most times they do a culture to just know what exactly is sensitive to that, and then
Hmm.
it treats it directly. You understand? So it's even save cost for you.
Yes,
Then
that's
also
true.
there's risk of antibiotics resistance. You just get resistance to unnecessary antibiotics.
Exactly.
And
Hmm.
then because okay, ideally you're supposed to start with the least, and because you've gotten so resistant to
To
that, you
eat,
now have to go and pay more. So you see,
get the higher one.
you're going to spend more instead
Hmm.
of going through the normal route. You go for these chemists, doctor chemist,
Yes,
and
and all that, to
yes, so
get
it's very
medication.
bad.
Some of them even go as far. I've heard some of them saying that they took one concussion. In fact, in this part of the world where we are, you hear a lot of them saying they have, in fact, the infection to almost every lady you meet, I'm treating infection, and they gave me one concussion like that. So you now wonder all this herbalist matter too is something
Yes, so
else.
there's infection
Oh,
drink, there's
goodness.
actually concussion drink.
So
Yes, there are
wow,
some leaves that they use. Yeah,
can
and
just
I
imagine.
forgot to tell you, there's some leaf that they bath with, or they sit bath with.
Oh my goodness.
Yes.
So you can
You
imagine, the danger of all these things is the dosage is not defined. So it means that
exactly.
even you are overloading your liver, your kidney, you are giving them so much work. If they even have to take all this concussion to now break down, next thing you start hearing some of them having one kidney failure, liver, and all that.
Exactly.
So it's just is really a menace in our society because you see a lot of people actually dealing with all this, and then you just wonder how did you get to this stage when I just a little coming to see the doctor, doing the basic investigation, the right medication would
Yeah.
have been. And it's good to note, viewers, that there are times that they can give you medication, and when they give medication, yes, symptoms might resolve, but even if you resolve, if you don't feel completely okay, please revert back and see the doctor. They might want to further investigate. Don't just assume that because they've given you medication now everything is solved, and then
Mm.
you just relax and you are not completely feeling yourself. Nobody says that you cannot come back to complain. Don't go further and say, this medication did not finish the work, let me add concussion to clear it
And another thing is
completely.
that the vagina is self-cleansing.
Wow.
God is special. He made it that way to cleanse himself by itself.
Yeah.
So it's when the symptoms are very bad, or that early stage, then you
Yes.
come. Sometimes you just don't necessarily need to take anything. It cleanses
True,
itself by itself.
true. So,
Yes.
with all this that we're learning, viewers, today, I know that we have a lot to learn from this today. While you were talking, I actually thought of the elderly women that are actually menopausal. A lot of them struggle with vaginal dryness, and when like you mentioned that the vaginal lubrication actually helps to create like a protective mechanism or something to prevent infection and all that for women. So now we have a bit of that lacking in the elderly women or those that are already getting into menopause. Well, is there something that you feel you can recommend for such women that are actually already dealing with vaginal dryness? I mean, because I know that somehow, no matter how it is, a woman will always not want to feel that vaginal dryness because to some extent, a little fluid around them makes them feel comfortable and makes them feel a bit healthy. I mean, even with respect to sex and all of that. So, is there something really that can be recommended for women of that?
Okay, yes, but primarily you could also use a lubricant from
Mm.
the early stage. Then, if it gets too bad, there's this modern day technology that's a vaginal rejuvenation.
Oh, I
Yeah,
see.
so
Okay.
this helps to provide another means
Wow.
to
So
keep the
so it
vagina,
restores
yeah,
their
restore
lubrication.
exactly.
Wow. So it
Yes,
means that, so for a woman that is possibly going through some of issues with dryness, it means that vaginal rejuvenation is a technology that is made available to you.
yes,
And I'm sure that we can actually access that at Alps Hospital, laser vaginal rejuvenation, that helps with restoration of lubrication, makes it less painful for when you have sex. I
yeah,
think based on all the I mean, I'm sure that you can check us out on house hospitals, because this is not for vaginal rejuvenation, where she's just letting us know. You can
mhm,
watch more of our videos just to see more about it and how vaginal rejuvenation works. And of course, if you have your questions, you can actually chat us a DM, and then we'll talk a lot more about vaginal rejuvenation. You can book a session, walk in and walk out of the hospital, have a good time and feel good, feel younger.
yeah,
Oh
you know,
yeah, feel younger. Well,
and get
so
your confidence
oh
back.
yeah, exactly. In fact,
Mm,
that's something that actually I feel like affects women sometimes as they
yeah,
age,
mm,
because the dryness that happens there, the way the vagina becomes laxed, makes them prone to infection, pain during sex.
yeah, and
If
worried that the husband will go outside
and
and all
all
that.
of that, so it
Yeah,
restores your confidence, your self-esteem as a woman.
marital harmony,
Yeah,
very
so you
important.
see, viewers, that's okay. So today is not for vaginal regulation. Maybe some other time we could talk about that. But that's just a bit that Dr. Divine has let us know can actually be done just to restore vaginal health for those people that might just be struggling with some of these things that we've talked about. So as we wrap up today, what's your counsel to women generally with respect to their vaginal health, vaginal discharge, and what's just your counsel to someone watching out there right now?
Okay, my counsel to we women, all of us women,
Yeah.
is that please let your vagina breathe. That's the first statement I'm going to start with.
Yeah, let
Vagina
it breathe.
cleanses itself. So sometimes in the night you can just sleep without any tight underwear. That's the first step of treatment.
That's true.
Yes, early prevention. So clean yourself properly. Avoid unnecessary antibiotic usage. Then practice healthy sex
Hmm.
in okay use of protection, or instead
Maintain one partner.
maintain one partner
Hmm.
or abstain.
Yeah.
Very important for married women. Please and try to take care of yourself too. I know it's not easy, especially when you're breastfeeding, when you're pregnant, the discharge is uncontrollable. It's okay, it's normal. Don't get yourself so worked up.
Walked up. Yeah.
Yes, every woman went through that same stage. So don't get too worried. It's okay. It will get better with
Hmm.
time. And then for young girls also, um avoid um avoid those things we listed
All this
already.
dodging, prolonged use of tampons,
Exactly.
all those and all that. Hmm.
And then keep yourself healthy. That's
Thank you
all.
so much, Dr. Van. While you were speaking, I actually just thought, like you mentioned, people and their partners. A lot of times when women say they have infection and they have partners, they treat themselves and go back to their partners,
Exactly.
and their partners infect them. So, how about to say when you are treating, your partner should be treating? So, I mean, I'm just thinking, this is me just thinking, because sometimes they even get this from their partners, and
Mm-hmm.
then the partner is not treating, and then she treats herself, meets this partner again, and then the cycle begins again.
That's
So
what
how about that? Maybe not even if the partner, but how about maybe when the woman is checking herself, the partner should be checking himself too. So both of them can treat. So the woman does not keep suffering. She's taking the medication and he just keeps giving it back to
I
her.
remember I met a girl that came almost 3 times, and then
Okay.
I asked her, "Okay, so where's your boyfriend?" She said, "He said he doesn't want to come. Blah blah
Oh,
blah.
you
He's
see, you
not the
see.
problem." I
You
just told her
see.
to her face, "Then break up," because at the end you're the one that will suffer
Yeah,
it.
very true, very true.
Eventually, if you have infertility,
And all that
the finger will be pointing at
at
you.
you,
The
exactly.
woman is always at the receiving end.
Most of the
If you made
time,
all the
yeah.
effort and then he's not forthcoming, leave the relationship. He didn't mean good for
For
you.
your exam,
Yes,
because
so
it's
that's it.
it's it's worrisome. So well, that's just a bit of digression, but we really think as a woman, we've actually had situations where some men silently come to meet the doctor and say, please, I maybe they gave the man, and you say, okay, I played rough play, or please treat my wife for infection. I think what she's going through is me that gave it to her.
Yeah.
Those, at least those men, they even try
At
to
least
own
he
up,
was
even though what
sincere a little.
exactly. But you have some of these men, they will do and clean their mouth, and then the woman
Mm-hmm.
will now be suffering. it's not the best. Please, I'm pouring this
Yes,
aggression.
please.
Women are suffering too much. Well, so please, the main thing is this: let's both partners take
And
responsibility.
please, men should stop body shaming women too. Yes, yes. Now that you understand that some discharge are normal, please stop calling woman dirty. It's just
Just
that phase of her cycle.
yeah.
Yes, please try to understand
We have.
with her.
Please,
Thank you.
please do. Coming from Dr. Divine. Okay, so Dr. Divine, we have a question. Someone is asking, what's the degree of PID fever? I mean, when will you say there's fever when a woman is having PID? What's the degree of fever that she'll have? I mean, it means what she's saying is what's the deviation from the normal temperature? How will she know she's having fever? It's a PID.
To me, I prefer using 38 degrees Celsius.
Okay, so
Yes.
so once you start getting to 38 and all, yes, it means that
With those
you
symptoms
that you
and
are having.
yes.
Mm.
Yeah.
If I once you have fever, you can't be sure that it's PID that's causing it. Any point if you are having fever, I mean, no matter whether you call it low grade or high grade, whatever it is fever.
Yeah.
So once you're around late 37s into 38 and above,
Yeah.
please, I mean, get help, get attention. Hope that answers your question, Abisola. Well, I know our viewers had a good time, and thank you so much, Abisola, for that question. So, viewers, please, for those of you that have your questions still coming up, of course, we'll attend to them via a private chat. You can actually book an online session with the number being displayed on the screen. You would also get response to whatever your concerns are. You can have an online consultation. I know you had a good time with Dr. Divine, but yes, you could also see us at our physical centers here in Jos or at Abuja. You could check us out on our handles. You'll be able to get a means of how to get across to us. But for now, we hope that you have enjoyed the rest of your evening. Bye.
Thank
Thank you so much, Dr.
you. Thank you for
Divine.
having me.
Mhm.
Yeah.